So if a patient has metastatic clear cell renal cancer, it depends upon what his or her performance status is, what are the associated comorbidities, because what studies have shown is that patients who have poor clinical features, and those are pretty well defined, and most of this work was done at Memorial Sloan Kettering by Dr. Moser, who defined patients with metastatic renal cancer as good, intermediate, and poor risk patients. So patients who fall in one of those categories will dictate to an extent what type of treatment you would give them up front. For patients who have good risk metastatic renal cancer, options include high-dose IL-2 therapy, which should always be kept in the back as a potential option in those patients, because to date it still has the best cure rates, albeit it's 5% or so compared to the targeted agents, which is less than 1%. So high-dose IL-2 therapy is one option, but most of us would probably use sunitinib as first-line therapy otherwise. Other options could include pazopanib, which was just recently approved, or bevacizumab in combination with interferon in good risk metastatic patients. Sorafenib can be used in patients who have failed sunitinib, but more so now based on randomized trials if patients have failed cytokine therapy first, for instance, interferon or interleukin-2, then the randomized data favors sorafenib, because that was where the largest phase 3 trial was done, where patients failing cytokine therapy were treated with sorafenib versus placebo, and patients who received the sorafenib had a doubling of their progression-free survival compared to placebo. So if you're a purist and believe in randomized phase 3 data, then sorafenib would be supported as the drug of choice in patients who fail cytokine therapies. Pazopanib is an interesting drug. It was just, as I've mentioned, very recently approved by the FDA. This was a trial done primarily overseas, not in the United States, in patients who were both cytokine naive and cytokine refractory patients. It was a 2-to-1 randomization of pazopanib versus interferon, versus placebo. And the outcome of those studies almost parallel that of sunitinib, in that with respect to progression-free survival and duration of response in the groups of patients who responded and objective response rates. However, you can't extrapolate two separate studies, so in fact there is an ongoing trial comparing pazopanib to sunitinib up front, head-to-head in metastatic renal cell cancer, cytokine-naive patients. And that will probably help us focus a little bit more in terms of where to position these drugs. One thing that is becoming apparent is that the toxicity profile of these drugs can potentially vary. For instance, the sunitinib may be different than pazopanib in terms of their spectrum of toxicities. For the newer targeted agents, you can divide them broadly into 2 or 3 categories. Toxicities associated with the tyrosine kinase inhibitors, for instance, the sunitinib, sorafenib, pazopanib, are primarily related to hypertension, increased risk of bleeding clotting. You can get some myelosuppression, hand-foot syndrome, rash, some GI toxicities, some diarrhea, nausea, vomiting. But these drugs are not created equal in that although the targets are essentially similar for these agents, the percentage of patients having one toxicity versus the other does vary a bit from for these drugs. Fatigue also seems to be a relatively common toxicity with these targeted tyrosine kinase inhibitors. One thing that is beginning to emerge is that perhaps with the pazopanib, it might be a little gentler in terms of its toxicity profile compared to sunitinib, although, again, there's no head-to-head comparison yet. But one thing that seems to stand out with the pazopanib is that there may be a greater incidence of liver inflammation with that drug. So there are some guidelines how to manage that if that happens. So again, we're beginning to learn more about these toxicities and tolerance after these drugs come out into the market with greater post-marketing use.